everyone. I am very excited to be speaking with Dr. Nick Belden today, the second chiropractic doctor we've had on the show since its inception. Dr. Nick is a board-certified chiropractic physician who has a deep passion for understanding the innermost workings of the human body. His mission is to educate, empower, and optimize the quality of life of every individual he encounters using the tools of functional medicine. He is fascinated by discovering the root causes of disease and dysfunction in order to better support the human body, and has been able to experience the power of lifestyle optimization through his own health journey. Dr. Nick, I love that bio. We would be friends in real life, but welcome to the show.
I'm thrilled to be a part of this. It's always so funny to hear your bio, because then you're like, oh yeah, is that still reflective of me? And how you want to describe yourself always changes. But yeah, I think that's
constantly updating. I love people who or update their bios on a yearly basis. I think that shows fan of that.
Yeah.
Anyway, I'm so glad to have connected with you. As we were just saying, my chiropractor here in Greenville, Dr. Kyle Yates, was kind enough to put together some names for me when I had asked him for recommendations of folks to have on the podcast. And you were the first name that he mentioned.
I love that. Yeah, he's such one of the most prominent movement gurus that I know. So you are in good hands yourself, having him as your chiro. Yeah.
I love that. Yeah, I'm a huge fan of his. I think he's brilliant, and I'm actually trying to get him on the show as well. So stay tuned
you
for
totally
that.
should. You really should. Yeah, that'd be fun.
Well, also too, as I was saying, it was a bit challenging coming up with a topic to chat about with you because you cover so much on your awesome social feed. So who knows, maybe this will be the first of many. But for the purposes of this episode, I would love to touch on an area that so many people suffer from and don't even really recognize it, right? And that is a dysregulated nervous system.
Yeah, I really think a lot of this has been exacerbated by everything that's gone on in you can call it the post C virus word pandemic, right? Of people becoming isolated, having to not have face-to-face human interaction as much. I think that has been a massive stressor on most of our nervous systems and causing us to adapt in ways that we didn't previously think would be an adaptation that was needed.
Absolutely. Couldn't agree more. So let's just start with the basics. Can you provide a brief overview of what nervous system dysregulation is and maybe some of the symptoms that commonly present with it?
Yeah, and yeah, I love this higher level question. And I'm sure you have a pretty astute listener base, so they're probably very familiar with this. But the way I always explain kind of the function or the main goal of the nervous system is to help keep the lights on. And so most people associate that with like the brain and spinal cord, so it's responsible for all of our movements, initiating all of our bodily responses we don't have to think about. And then when I think about like breathing and heart rate and digestion and things like that, and then I think about, how does that present in terms of nervous system dysregulation? I really think for a lot of people, it's an inability to be interruptible or an inability to adapt to their environment. And what does that even look like practically? People who say, I don't do well in large crowds. Or I know for myself personally, I used to so myopically focus on my health that anytime my sleep hygiene was interrupted or I saw blue light within an hour of going to sleep, my sleep was ruined probably via a placebo effect. Or if I ate gluten and someone told me, I was like, oh, I'm a wreck. Where it's like, did it really hurt me that much? And to me, that was just an inability to adapt to our environment. And to me, that is a hallmark of a nervous system that could use some support, could use some TLC, could use some love. And it's really, I think a lot of us health conscious folk probably deal with more than the average person would think.
Yeah, I resonate with all the above. And the irony too, it's like, is ignorance bliss sometimes, like knowing, like, again, like you said, that placebo effect. If I have a gluten intolerance, for example, anytime I do accidentally consume gluten, I will experience brain fog for like a week. And then part of me is like, is this self-induced or is this actually because I ate gluten?
Right. And for you, that symptom though is very real. So then and if you have pinpointed it down to it is gluten, then in your system and your nervous system, then it probably could be gluten. That's where it's always tricky to tease out, like what really is the stressor that's causing the cup to overfill.
Yeah. And speaking of stressors, what are some common factors, right, or conditions that can lead to nervous system dysregulation? Chronic stress is obviously a big one, but I've also read that like metabolic disease, hormonal imbalances. What are some others?
Yeah. And the way we explain it here between my wife and I is there's three different types of stressors on the nervous system, really. You have physical stress, emotional stress, and chemical stress. And I think most people might be familiar with the idea of physical stressors of a car accident, of traumatic brain injury, like concussions in football, things like that. And chemical stressors are going to be, like you talked about, your hormonal imbalances, blood sugar dysregulation, gut microbiome dysbiosis. And the one I've actually been paying a lot more attention to is emotional stressors. And I think that's what most people think of when they think of as stress. So there could be something that's unpredictable. Say, I imagine we're not parents yet, but for parents, a lot of that is very unpredictable in terms of how your kid is going to react, or if you feel like you have a lack of control. So if you're in a job where you don't feel like things are happening the way you want them to, and you feel like you can't really control how other people respond, which you really can't, that in and of itself is emotionally stressful, and that is a stressor on the nervous system. So then a lot of what I feel like I help or support people with is identifying how these chemical and emotional stressors sort of talk to each other and can sort of feed back and be very contributory to their overall symptoms of fatigue, bloating, brain fog, and.
Yeah, that makes sense. And just curious of your thoughts on this, but is it a chicken before the egg issue with hormonal imbalances? So, for example, right, does someone first start to experience nervous system dysregulation and then become diagnosed with like a PCOS or other estrogen dominant disease? Or is it the opposite?
Yeah, and that's a fantastic question. I don't think there's a perfectly right answer to this. My general thought is that I feel like hormonal imbalances are the end stage, like you said, of other stressors happening. So whether that's heavy metal chemical stress, whether that's unresolved childhood trauma, emotional stress, whether that's post-traumatic brain injury because you fell from the second floor of a window, physical stress. And I think the hormonal imbalances are really the end stage. They're the effect of the other causes that take place. But then as you get hormonal imbalances, then those themselves become causes of other things. So then it's both a chicken and an egg a lot of
Yeah,
times. Yeah,
it's a vicious cycle, right?
right.
And with that too, are there any particular disorders or conditions that are closely related to the dysregulation of the nervous system? I've heard that OCD, ADHD, for example, those could be related somehow.
Yeah, I would say, I mean, definitely a lot of those, what people used to deem as like purely psychological conditions, we now understand have lots of implications with gut microbiome and even nutrient deficiencies. And I think my favorite one is IBS. The so many people that I work with that have IBS have been told the classical, hey, it's all in your head. You're fine. We ran all your labs. Everything's normal. And what's interesting is when you get told by a physician, it's all in your head, you're fine, and you don't feel fine, that in and of itself is stressful to the nervous system. So I think a lot of us healthcare providers need to be very specific about how we word like certain diagnoses and certain things. Because if you tell someone, oh, hey, you have IBS, they now have a label, and it's now stressful knowing that they have quote unquote IBS versus previously thinking they just had some digestive discomfort. So it's interesting how like the wording that we use to people can be such as significant of a nervous system stressor.
That no, that's so true, and I love that you touched on IBS because certainly we know that the gut contains a large portion of the nervous system, right? And
Mm-hmm.
that inflammation in the digestive tract can overwhelm nerve cells. So, with that, how can nutrition impact the nervous
Ooh.
system? And what are your thoughts on, I guess, like, I don't know, maybe an elimination diet to help stop inflammation, to hopefully improve symptoms?
Yeah, and it's the classic answer where people have to start off with it. Everyone is their unique biochemical person, and so everyone's recommendations will differ. But in the beginning of my career, I was more focused on using elimination style nutrition with people and be like, hey, just don't eat this and you'll be fine. And then you work with enough people and you realize that that sort of like restrictive mindset can also lead to back to this theme of a nervous system stressor. So that really forced me to adapt my thinking and say, hey, we know from a gut microbiome standpoint, one of the best things you can do for gut microbial diversity is have diversity in your nutrition. So I've sort of wrapped my thinking and much more focused now on, hey, how can we get you eating a wider variety of foods more than just focusing on what foods to avoid. And so, because even a lot of health conscious people, we eat the same 2 or 3 fruits and vegetables each week. And I totally relate because it's easy. We go to the grocery store, we know what we know how to cook it, we know how to make it. But I find that when you get people focusing on foods they've never tried before or foods they've never eaten and they introduce those, their microbiome loves it, their nervous system loves it because their microbiome and nervous system love it, their immune system love it, and then they have less food reactivity and then they have less symptoms in general. And then it's really powerful to see the look on people's faces when they're like, oh, I don't have to focus on what things to avoid. It's like, no, I mean, I know life happens and you'll end up at a birthday party, which you'll probably be in a different digestive state when you're at a birthday party versus at work. But if I find that if you get people focusing on, hey, just can we get more than like 30 different kinds of fruits, vegetables, nuts and seeds, things like that in a week? And I think you'll be shocked at how much better your digestion, mental clarity, focus, all the things, et cetera, can feel from that.
Absolutely. I love that. I know diversity is truly key. And I really do emphasize that when folks ask me too, like, what is the quote unquote perfect diet? I'm a huge advocate of the Mediterranean diet. But interestingly, and I'm curious just in general, your thoughts on this. What about completely omitting gluten and dairy? So I know like Dr. Yates and I, for example, we eat pretty similarly. We don't have gluten or dairy, but I know this is a little bit of a nuanced area, right? And I say this in the context of someone who doesn't have any type of known gluten intolerance. Are those two things that you think should just be avoided in general?
Yeah, and this is a question I think about every single day, both on myself and then also clinically in the people I work with. And I think it comes down to what the person is willing to take hold of. I think in today's day and age, if we're talking about nutrient density, a lot of gluten containing foods, I mean, let's be honest, aren't the most nutrient dense. But then when you get into the dairy conversation, there's from vitamin K2 to vitamin A to even a lot of potential like beneficial fatty acids or even beneficial microbes in fermented Greek yogurt. So to me, I look at dairy as more of a thing that like, hey, there's a lot of stuff in there that's hard to get elsewhere. But when I think about gluten and wheat, I'm like, most of those vitamins are fortified anyway, and you can get most of the things from other nutritional sources. So then I have people say, like, do you feel like avoiding gluten and dairy is something you can be consistent with? And some people are like, absolutely, like I could go my entire life and never touch cake, ice cream, bread, and I'm totally fine. I'm like, great. Then in your instance, maybe it's not stressful for you to avoid it, so you can go ahead and avoid it. And then some people are like, well, my kids always bring home food or they go to birthday parties or I make them things and then they don't finish it. So then I feel like I want to have like bread or like their snacks every once in a while. So I'm going, okay, in your instance, I think we need to be honest and say, we would love to sit here and say, oh, we'll never eat them. But I think if we can train our nervous system and our mind and even the microbiome to occasionally see it, because you think of the person who never eats gluten and then they have it once every 6 months, then like I get a reaction. Well, it's like, yeah, because your immune system never sees it. So when it sees it for the first time, it's like, what is happening here? So you almost like microdose someone with that little stressor and you induce this little hormetic response, especially if you're a parent and you're going to be exposed to all those different food proteins. But it really comes down to what I always tell people, like, what are you willing to do? Like if you're willing to avoid it, you can live a complete normal life without it. And then if you want to include it occasionally, then we talk. My goal is to help people be able to handle like the broadest nutritional approach that they want to be able to handle. So that was a very long-winded answer.
No, I love that. That's so true. And that reminded me, I was reading the other day too, interestingly, again, just talking about like the extreme effects that our bodies create when we omit something for a while. So for example, someone who follows a ketogenic diet, right, for like 6 months, a year, or a carnivore diet, something very extreme, anytime that person even has like one blueberry, for example, their blood sugar will spike so high that it could essentially like resemble a diabetic. And again, I think just like you said in the beginning of the episode, restriction is really not the answer. And I think too, for folks going on elimination diets, there needs to be a set time frame, right? So what are your thoughts too on like, I guess the perfect time frame, or not necessarily perfect, but the ideal time frame, right, for someone to be on an elimination diet?
Yeah, and if you look at, so I've used a low FODMAP intervention on a lot of my digestive symptom patients, and low FODMAP is also becoming, every elimination diet is now becoming controversial in some circles. But if you look at the literature on low FODMAP, it's always recommended between 4 to 6 weeks, and I think we do that because we know like certain immunoglobulins take 3 to 4 weeks to turn over. Microbiome changes can be turned over very fast between like switching various nutritional interventions. So if I do use like a low FODMAP style approach, I'll have someone try to stick with it for 4 to 6 weeks and try to pinpoint the specific FODMAPs that they might be intolerant to. And my thing is, I feel like the food you're consuming most often is probably the food that's most contributing to your symptoms, because you're always exposing your microbiome and subsequently your immune system beneath that microbiome to that food. So if you have lots of bloating and digestive stuff and you're eating, let's say, raw broccoli or raw cauliflower every single day, I'm like, hey, maybe we start at these foods that are healthy, but for your current microbiome might need to be shifted, and then 4 to 6 weeks, and then see how resilient the nervous system and their gut has become, and then see if we can introduce them with minimal symptomatology.
Interesting. And
Yeah.
again, this could be a whole other episode, right?
Oh,
Just
yeah.
on nutrition. So
I'm going so many places. Yeah. Yeah.
I love it. I love it. Again, there's so much to cover, and it's such a complex area, right?
Mm-hmm.
So I love that we touched on nutrition. Can we touch on some maybe lifestyle strategies for someone with a dysregulated nervous system? And I think you had a recent post on this as I was scrolling through your Instagram. You had like your 3 favorite ways to train your nervous system to feel safe. Could you elaborate on some of those?
Yeah, my God, this is probably one of my current favorite topics to discuss. And the first one is the first one's going to be a derivative of nutrition. And it's, we focus so much on what we eat, but we undervalue how we eat. So our eating environment, are we eating while working? I have people do some lifestyle logging, and you find so many people eat their meals while they're answering emails. And what is probably the most stressful part of all of our days? Answering emails. So people are, you want to be in this quote unquote parasympathetic rest and digest state when you're eating, but you're answering client inquiries that are incredibly stressful to answer while trying to digest your food. I'm like, this is a very conflicting state for your nervous system you're in right now. And then
quick
people are.
Note.
No,
yeah,
sorry,
no,
go ahead.
I was just going to say, quick note on that too, Dr. Nick. One of my very first episodes on WellnStrong, we touched on that very topic. The state in which you eat your food can actually affect the nutritional impact of the foods you eat on your body, right? So if you're in a stressed state, your body won't extract the proper nutrients from the food, and you could be eating the healthiest of plates. But again, it's that emotional mental state when you're eating it that determines whether or not you're actually getting nutritional value from your food. So I think that's a fascinating area.
Mm-hmm. Big time. I remember when I was in graduate school, which was incredibly stressful, I would come home at night and I would eat like blueberries, avocado, ground beef, sweet potato, all like the paleo friendly things. But I would be eating it on my bed when you should not really eat where you sleep. And I would be studying for an exam, and then I would feel incredibly bloated afterward. I'm like, why do I feel this way? I'm eating the cleanest possible things, and realize, oh, that's because I'm not in an ideal, safe environment for my nervous system right now.
I relate with that.
Yep. So I really think and then eating with other people, and we have so many people now, and I'm still guilty of this, like eating by myself or eating while watching something, which it's so easy to do. And I find that whenever, you eat with others, you're in a different nervous system state. So you might have better food tolerance when you're eating with loved ones versus eating by yourself as well. So that's another fascinating area.
Yeah. I've started a practice where I'll set aside a half hour for lunch, right? So I'm not also just forking down my food.
Yep.
And I will go sit outside on my little porch or my balcony without my phone, and I will just sit and I will eat for a half hour. And it truly has made such a difference.
And that's a good segue into like one of my other favorite tactics, and that's using eye movement exercises. And I think, like you just said, part of the reason why, say, when we go outside, or say you walk up to a beach or up to a lake, or when you see mountains in the background, you see this vast array of nature. And then as a result, your pupils are actually, this is going to get a little technical, your pupils constrict as you start to look at things far off into nature. And as your pupils constrict, that's actually a parasympathetic response. And you're like, why would that be a parasympathetic response? Because if something was attacking you in front of you, you want your pupils to be really what's called dilated or open, because you want to be able to see every part of that spear or that, quote unquote lion that's coming after you. So if you flip that script and think about how many of us, when we eat, our phones are right in front of us, our laptops are right in front of us, so our pupils are always in this dilated state, which is a sympathetic response. If you flip that and then you look at like mountain ranges, or you look out off at the ocean horizon, and you like really fixate and sort of gaze around that, you can constrict your pupils and shift your physiology into a state of more parasympathetic dominance versus sympathetic. And it's
I
so
love
easy for
that.
people, when they go walking, just like look at the trees as you're walking by them instead of looking at your phone.
Yeah, it's so funny. You're touching on so many topics. You're like bringing everything full circle in all the previous episodes I've had. This is like the culmination, but literally in an episode I just had on Tuesday, I spoke with Dr. Nicole Kane. She's been a longtime friend, and we were chatting about anxiety, and again, just some tactical strategies to shift your body into that parasympathetic state. And I had read a while ago that just looking up, right, the practice of looking up into the distance can activate that. So that too is another strategy that I've really try to integrate into my daily routine, is taking a chance to just go outside and look up and just feeling the difference. But it really does make a difference. And again, I think the consistent theme here is just small habits, right? It doesn't have to be life-changing overhauls, just small habits that really do have massive effects.
And I think I love every bit of that. What I've found is that sometimes it's hard for us to wrap our minds around the idea that small habits will have these large cascading effects. Like we're looking for the detox, we're looking for the fix, we're looking for the short-term solution, even in the quote unquote like natural holistic world. And it's like, man, if you can get on board with the process and these small habits done over time having incredible impacts, like you'll discover how like you're the most empowering person for yourself. And then like being able to sustain those is just, then you're the driver's seat of your own health.
Yeah. Have you read
Yeah.
Atomic Habits by
Oh
James
yeah. Yeah.
Clear?
Love that
Yeah,
book.
that's
Yep.
one of my favorite books, and
Mhm.
I'll link that in the show notes for listeners. But it's just the concept of, again, small sized habits with life changing, massive implications and effects. Great book. I'm a fan of his newsletter too. He sends out a weekly newsletter with like 3 quotes and 2 ideas and something else. But
I gotta get
he
on
has some
that.
great
Yeah.
work. Yeah, you do.
Mhm.
It is life changing.
Yeah.
All right, so we touched on that, and then your third favorite way to train your nervous system to feel safe?
Oh, yeah. Yeah. I would say consistent sleep hygiene. And what do I mean by that? I think I used to work in corporate America, so I used to fall prey to this all the time, is the idea of social jet lag. So, we wake up at, 4:30, 5:30 a.m., Monday through Friday. And then Saturday, we're like, God, don't got to wake up for anything. I'm going to sleep till 7:30 a.m. And I completely understand why people do that. But then what you find is that what you're teaching your circadian rhythm is kind of the equivalent of, for parents out there, they can relate to this. Say you feed your toddler one day at 6 a.m. and the next day you feed them at 9 a.m. That day you feed them at 9 a.m., they're going to be expecting food at 6, and they're going to be incredibly cranky for 3 hours. And so when our sleep schedule is that erratic, we're teaching our circadian rhythm, which is responsible for everything from energy production, immune modulatory things. I mean, everything nervous system related, you're teaching that to be incredibly dysregulated. And you're teaching the factory to turn on at different times of the day, where it's like, if we can get your wake up and bedtime within the same hour window, I think that's a good place for people. It's crazy what that can do for, I wear an Oura ring. And so my HRV is incredibly consistent when my sleep schedule is incredibly consistent. And as that starts to become varied, and I was in Nashville visiting my brother a couple weekends ago and was out later than usual, and my HRV showed it. And I'm like, oh, this is crazy. Like even 1 or 2 nights of this, you don't have to be perfect, but I think if we can build in that habit of like the sleep consistency, then you can get in things of temperature, meal timing, other different supplements that are always fun to talk about. But I really think that the consistency aspect has been one of the most impactful thing I've seen for both myself and my patient population.
Yeah, I couldn't agree more. Sleep is definitely something that I protect.
Yep.
My bedtime is like 10 p.m. at night. And if I'm in bed later than 10, the next day is just completely awry in so many, not so great ways. But couldn't agree more with that. And just curious, asking on a personal note here, how does all of this relate to HPA axis dysfunction? So I am working with a naturopathic doctor because I'm working on practicing what I preach, right? And interestingly, some recent blood work revealed that my cortisol levels are extremely low. And I know that at some point in my past they were extremely high, right? So that's just the natural progression of what we can call adrenal fatigue, right? And I'm tired all of the time, and now I kind of have a reason why. So, would someone like me, for example, does HPA axis dysfunction automatically mean that I have a dysregulated nervous system? And I guess would the way to treat that be similar to how you would, to all of these things that we're discussing that you would use to address a dysregulated nervous system?
Yeah. And if you don't mind me asking a follow-up question, was that your morning cortisol? Like, did you do like blood work fasting in the morning?
Throughout the day. So
Oh,
I
so
did,
did you
yeah,
do
it
a
was like
cortisol awakening response?
I did.
Mm-hmm,
I
mm-hmm,
did, and it was very very low, which again
mm-hmm.
is not good, but it's great that like I was able to pinpoint why I'm feeling the way I'm feeling.
Yeah. Yeah. And I appreciate you sharing that information. And, if to break down the HPA axis, I'm sure the listeners are familiar. The first word in that is hypothalamic. And the hypothalamus is the brain region that's the master endocrine gland, right? And that's part of the nervous system. So if the HPA axis originates from the nervous system, like the hypothalamus, then really HPA axis, in my view, is looked at more as a condition of, I want to say, brain biochemistry. And that's not me saying it's all in your head. I mean, anatomically, is it all in your head? Sure. But the connotation of that phrase is very different versus the previous idea that, the adrenals just get tired, where it's like, actually, the adrenals are doing exactly what they're told to do via the nervous system. So to answer your question, I really think, yes, it is more of a symptom, a progression of stressors, physical, chemical, and emotional, weighing on the nervous system. And then for you, the symptom is HPA axis dysregulation. For someone else, it could easily be IBS. For someone else, it could be easily PCOS, right? So that symptomatology manifests differently, even though those root stressors might be similar across the board.
Interesting. And you mentioned physical stressors. So this is
Yeah.
another, I guess, nuanced area, right? The whole concept of hormetic stressors, which for listeners is this idea that, short-term exposure to stressful things like cold water immersion, sauna therapy, even fasting, right, does have long-term beneficial effects on the body. But what are your thoughts on doing those practices for someone who already has HPA axis dysfunction? And I am guilty of this, I will say right now. I do my sauna pretty much every morning, then I'll hop into a cold shower. So am I just contributing to that cycle? Like, how does that work?
I love this. And I think it all depends on your current level of stress tolerance. So I explain it kind of like you have a cup of water, and if you overfill that cup, then that's when sort of symptoms happen, right? So if a stressor is a poor night of sleep, that fills up 4 of the 12 ounces of the cup. If then you do, probably cold exposure is probably, I would say, more physiologically stressful for most people than sauna. Then if you do cold exposure, then that adds another couple ounces of stress, and then other things happen. Then at some point, the stress cup just overflows. But if you're in a state where the stress cup is either pretty large, so you have like a 40-ounce cup instead of a 6-ounce cup, you're going to be able to tolerate more stressors. And the ironic thing is that things like cold exposure can help increase your stress tolerance cup, but it can also add to your cup. So it's this sort of waxing and waning thing. Like I had a patient who was doing cold exposure every day, and they were like, "Hey, could this be I've started sleeping poorly." I'm like, "Oh, when did that start?" And they're like, "Oh, when I started doing cold exposure every day." I'm like, "Okay, can you do it every other day?" And they did that, and their sleep improved. And I'm like, I think for them at that season of life, that was just too much physiologic stress to where they couldn't fully adapt to it.
Yeah,
Yeah.
interesting. And to the point too with fasting, again, like I just, especially when I do podcast episodes, right? I like to be in a fasted state because I find that helps to boost my focus. But for someone with a dysregulated nervous system, I mean, we spoke about nutrition, but even food timing, should they be eating more consistently throughout the day rather than, I guess, having their first meal at like 11 or 11:30?
I used to be example numero uno of this. When I was in grad school, I was not only doing daily 16-hour intermittent fast while also doing CrossFit in the morning while also having caffeine. So just incredibly jacking up every part of my nervous system. I was also doing frequent 48-hour fast. And what's crazy is every time I did a 48-hour fast, my sleep was absolutely terrible. But I'm like, God, everybody says fasting is the greatest thing ever. I might as well just keep doing this.
Yeah, I did one too.
Yeah,
I did a 48-hour fast about 2 weeks ago, and I just could not sleep, and I was wearing a CGM while I was doing it, and I found that my blood sugar went down to the low 60s, which we know is not super great.
Yes.
But I resonate with that.
Yeah, and there you go. That's the telling answer that maybe, fasting is this incredibly beneficial therapeutic tool, especially if you have a lot of underlying insulin resistance. But if you're already pretty health conscious, I mean, yes, it is cool to challenge ourselves. But I think, at certain seasons, I think our stress tolerance should be more focused on, protein dosing and optimal ratios and I say optimal, it's different for everybody, but getting enough protein in the day, getting enough calories in general, especially if you're dealing with HPA or nervous system dysregulation. I think there can be a season for prolonged fasting, but I've, for the past couple of years, actually avoided prolonged fasting in a sense to heal my own years of chronically cranking the nervous system into, that sympathetic mode. So I think there can be a season where you can return that, but there might be a season, like you said, yes, to prioritize protein feedings, adequate calories, adequate fats, carbs based on how much you can tolerate and things like that.
Yeah. Speaking of carbs too, I mean, the naturopathic doctor I'm seeing also recommended, she's like, you need to get more complex carbs into your diet. What are your thoughts on carb cycling?
I love all these topics. For some people, I've seen it work wonders, especially for people's sleep. I know, people have this idea that, carbohydrates will help with the serotonin and subsequently melatonin response. So if I have them before sleep, it helps my sleep. And so I found for some people that works. I found some people, if they have a certain amount of carbohydrates, for them, it just spills over into binge eating, and which has much more deep-seated nervous system issues than just simply the carbohydrate tolerance. But I really think it comes down to what the person feels like they can be consistent with and how metabolically healthy they are. If you have a fair amount of muscle mass, if you're strength training with pretty good consistency, you can probably get away with a larger carbohydrate load just because you have more muscle mass, some more glycogen reserves to be able to handle. You have better insulin function, likely, if that's part of your personal habits. And then if we don't have those things, then we need a little bit more nuanced about how we use carbohydrates, if they can stick to it.
Interesting. All right, good to know. I'm going to keep that in mind.
Yeah.
Super interesting. Unrelated to nutrition, but again, asking on a personal note here. This is great. It's just free medical advice
I know,
for myself. That's why I love podcasts. But interestingly too, looking at my own history, and I've shared this with my listeners in the past, I had a pretty bad concussion sophomore year of college. Actually a few, but my first pretty bad one was sophomore year. And interestingly, looking back at my medical history, I noticed that a lot of my, I guess, hormonal imbalance issues, for example, started to develop right after, within a year or so of having that concussion. And looking back again, I've done so much research and I recognize that affects so many different things, right? It's not just a matter of, you get a concussion and you heal 6 months later. There could be lasting implications from that. So my question for you is, how does neuroinflammation contribute to nervous system dysregulation? And, what are some of the potential long-term consequences of that? How do patients who have had, TBIs in the past mitigate the risk of developing some of those, I guess, lasting symptoms?
I will say that I wouldn't say I'm an expert in the concussion world. I probably know enough to know where to send people. And I have, I've read things on hyperbaric oxygen being incredibly therapeutic for people with TBIs. I don't have any clinical experience with that, but I've heard enough anecdotes from there's probably something there. And I've also heard the anecdotes of people using therapeutic ketogenic diet and high dose MCT oil for things, TBI. But, I will say that is probably getting a little bit outside my knowledge base. But, on the neuroinflammation front, I would say, it really comes back to those three stressors. Neuroinflammation could be caused by the TBI. It could be caused by the dysbiosis in the microbiome that's then traveling through the vagus nerve up into the actual nervous system. So then it really does come back to hey, identifying those three primary stress areas, finding which one is currently most affecting you. And then, is it vagus nerve related things? Like, do you need to gargle water? Do you need to do like splash cold water on your face, which I know can be very therapeutic for people? Do you need to do eye gazing exercise for vagus nerve stimulation things? And then, giving the brain the proper nutrient oxygen supply. Could you be having like upper airway breathing troubles during sleep that's preventing oxygen from getting to your brain, that's further exacerbating TBI? I mean, it's all this like cascading related things that like, yeah, it could be contributing to the neuroinflammatory state.
Interesting. Yeah,
Yeah.
I agree with you there. I did another episode on concussions not too long ago, and ozone therapy is definitely a huge
Yep.
game changer.
Mm-hmm.
Um, I'm a huge fan of certain supplements as well. I overdosed. I hit my head a few weeks ago playing volleyball after work
Mm.
one day, and
Mm.
first thing I did was ran home, started dosing with like NAC, a bunch of homeopathy. I actually went to go see Dr. Yates like the day after because I was
Yep.
freaking out. I was like, I need
Mm-hmm.
someone to check me out.
Mm-hmm.
But I obviously was fine. But those therapies are also super helpful.
Mm-hmm.
You touched on the vagus nerve,
Mm-hmm.
which is again very relevant to this conversation and a huge area of focus or interest rather of mine. Can you just explain to listeners what that is?
Yeah, and it's probably one of the most prominent buzzwords in like the holistic and natural health community. And I love that some names sort of tell you what the nerve is about, and they literally named this thing the vagus nerve because of how large it was. So it sort of tells you where it's coming from. So it's called a cranial nerve, which all that means is it originates from the brain, and it is the longest nerve in the body. So I remember when we were in the anatomy lab in graduate school, you would see how long this nerve is, and it literally looks like a cable. And then it was actually one of the hardest things to cut. Like, it was so solid and so strong that with like scalpel, trying to cut through this nerve was incredibly difficult. So it runs from your brain and essentially travels throughout your entire viscera. So throughout your entire internal organs, helping with everything from digestion to respiratory things to cardiovascular things. I mean, it's really the chief nerve responsible for keeping all of these critical bodily functions within the internal area. And then for a lot of people, we talked about IBS earlier, sometimes the vagus nerve is either getting, we'll call it like inflammatory input from the gut that is then causing like a lot of those digestive symptoms. And in some people, like the vagus nerve interference could be manifesting as like irregular heartbeats or even dyspnea or trouble breathing. So you really have these, quote unquote, functional imbalances in the vagus nerve can manifest in so many of those symptoms that we associate with like internal organs and internal health.
Super interesting.
Yeah.
Wow. Yeah, I know. It's such a buzzword, right? Everyone's like, "Oh,
Yes.
how do you stimulate your vagus nerve?"
Yeah. It's like talk. Yeah. Singing,
Yeah,
dancing.
exactly.
Yeah.
Exactly. And I did want to touch Dr. Nick on the benefits of actual chiropractic care, since obviously that's your area, in terms of, again, managing symptoms related to a dysregulated nervous system. How does that work?
Yeah. So full transparency, I actually don't adjust people. So I'm a chiropractor by trade, but my model is more of a consult, sort of like the functional medicine, holistic health route. So, lab work, nutrition, stress management, sleep hygiene. But my wife, who I always say is an adjusting whiz, and she works with like the pregnancy and pediatric population. And it's crazy
Cool.
how, like, I previously was a little skeptical, even like being in chiropractic school, I was skeptical of that. But when you see it happen live, a parents will walk in and say, "Oh my gosh, they're pooping again." And I'm like, "What?" I'm like, "Just by getting adjusted?" I'm like, "Dude, that's crazy." Like, what? The nervous system is that. Or kids coming in who had incredible behavioral issues, and they walk in and the mom's like, "Yeah, they're completely fine now." And I'm like, "What?
Yeah.
That's a thing? That's
That's
crazy."
incredible. I'll
Yeah.
have to have your wife on. She'll be another episode. That's fascinating, though.
Yeah. Yeah. So I would
Super
say,
cool.
yeah, I mean, and you really think about what a lot of what the adjustment is doing is
Yeah.
it's like almost a hormetic stressor on the nervous system, right? And it's sort of teaching it to properly adapt to its environment. So, I know when the C word virus first happened, there were some people saying out there like, "Get adjusted, it's going to boost your immune system," which there's a whole nuance to that. But really, what it's doing is it's mildly challenging the nervous system and helping it adapt to have more resiliency. It's really what it's doing. So anything like the bigger picture strategy is helping achieve greater nervous system resiliency. And whether that's adjusting, whether that's cold exposure, whether that's like high intensity interval training, like any of those things really fall into that bucket. Like, how do we help the nervous system become more resilient to our external environment?
Super interesting. Yeah. I mean, quite honestly, I never really like knew much about chiropractic care
Mm-hmm.
prior to January of this year when I started seeing Dr. Yates. Like, people were like, "Oh, like you're into nutrition and wellness and you've never seen a chiropractor before?" And I was like, "No, I have not." But he has opened my eyes to so many different things, and again, just a really helpful and interesting area. Um, but I do want to be cognizant of your time. I know you have a patient in not too long, but where can listeners find you?
Yeah, and this has been I thank you for this. This has been such a and it's fun conversation. And it's so cool to talk to people who have thought about this on a deeper level, right? They've given it time, they've experimented themselves, because it's so powerful when you've had so much self experimentation, because then you have like wherewithal to know how to discuss it. So I thank you for spending your hard-earned time, effort, and energy to go through all those things to be able to have this discussion. So for me, I'm probably currently most active on my podcast. It's called Gut Check Radio, and I need to get you on. We need to get more about even like the TBI story. And it's really, for me, I found my passion is just helping uncover people's stories, and particularly people who work in holistic health and wellness. They all have a fascinating story that brought them there. So to me, one of my favorite things is just interviewing people and helping unpack, oh, hey, they became an MD or a chiro or a pelvic floor therapist because of like this that happened, or because of, like, I interviewed someone recently who had a TBI and had to relearn to walk and talk, and now works in like the pelvic health space because she found it so impactful on her. So it's just so fun to talk to these people and what worked for them, what things they found, and their trials and tribulations and all of their gut check moments along their life and health journey.
I love that, and I couldn't agree
Yeah.
more. It starts with the problem, right? We all
Yeah.
experience something, and it's just a matter of how you use it. So
Mm-hmm.
couldn't agree
Mm-hmm.
more. My last question for you, Dr. Nick, is what does being well and strong mean to you?
Oh, I love this. So years into my health practice, I was worshiping my health. And what that did for me was it actually led me to become incredibly unhealthy. And it wasn't until I reevaluated, and as a Christian now, it wasn't until I reevaluated my relationship with what I worship that really caused me to think, hey, the whole reason I'm working on my health previously was just for me. It was incredibly selfish. And while there's an element of being selfish, I think truly being well and strong is the intention behind why you work on your health. And to me, it really wrapped around to who can I serve now and who can I serve more or better because of my now improved health. And I think to me that has, along my healing journey, the most powerful thing for me that has helped me become incredibly more well and strong is my faith practice, and really understand like why in the world am I on this world?
I love that, and I definitely resonate with that. I mean, my faith has been a huge part of the building of this platform. It wouldn't be where it's at without God. And I think one thing that's really important is, the Bible says our bodies are temples of the Holy Spirit, right? And if you change the perspective at which you look at your body, you'll start to change how you treat it, how you feed it, the thoughts you think, and spiritual healing is a big part of healing, right? It's not just physical and emotional. So that's something I really try to emphasize with my followers, as they all know.
Mm, amen.
Love that. Well, Dr. Nick, it's truly been a pleasure. You're such a wealth of information. I'm so grateful for your time, and I definitely look forward to having you back on. I will link your podcast and your social handles in the show notes. But I just really appreciate you and all of the wonderful work you're doing. So thank you.
Thank you. And I appreciate the space and the time to discuss these things. It's been a blast.
Awesome.